Well, we are back here at Tri-Cities Gastroenterology, the Center for Digestive Wellness, and we are joined today by Dr. Jeffrey Fenyves, and we're talking today about a topic that I think a lot of people can relate to, may have heard about it, may be suffering from it, and that's GERD. And Dr. Fenyves, thanks so much for having us out today.
Oh, happy to do this. Thank you very much.
Well, first of all, GERD is something that you actually kind of hear about a little bit now. It seems like more and more people are figuring out that, hey, I might be suffering from this.
Oh, it's a very common symptom. Maybe as many as a quarter of the public have acid reflux at any given time. You know, the biggest thing is, what's the definition of acid reflux? And a lot of people think that acid reflux means it has to come out their mouth, and actually it's typically heartburn. Heartburn with burning in your chest, so the acid only has to come from the stomach below the diaphragm into the chest where the esophagus is, and that's what we define as heartburn.
And we think a lot about heartburn. We think about diet and certain typical foods, but are there certain people who might be more at risk for GERD or acid reflux?
Sure, great question. Yeah, for instance, asthmatics are at high risk, and of course we have a lot of people with allergies and asthma in our area that suffer with that, and those people breathe differently, and they are much higher risk for having problems with acid reflux. And along the same lines, like people with COPD, which is emphysema or smoker's disease or just bad lungs, also can have problems with acid reflux.
And is it the type of thing where some people may have it at this level, but other people may really suffer, and it could be a continuous problem?
Well, and that's a great question, too, because some people have it at a much higher level, but their symptoms are actually not that high. For instance, the elderly, often after 50, 60 years of age, your symptoms may be very minimal, but you may have a horrible case of esophagitis when we look in the esophagus.
So I would imagine the treatment then is different depending on the individual patient.
That's correct. Yeah.
So sometimes can it be as simple as adjusting your lifestyle?
Yeah, we'll start with lifestyle, mostly with reflux, and that includes, you know, diet. But believe it or not, a lot of the diet issues are not about what you eat, but when you eat it.
Okay.
People that eat late at night, for instance, that work shift work and come home at 11 o'clock and eat their supper at midnight, they often will suffer with a very difficult course of reflux. And they may not know what it is because they don't have symptoms when they go to bed, but all the next day they feel terrible.
So are there different treatments then? Are there some times where you have to do a little bit more?
Sure, yeah. Most of the treatments that we use employ medicines that reduce acid output from the stomach, at least for a temporary period, to allow the esophagus to heal. The esophagus will handle what we call physiologic or normal amounts of acid coming back up into the esophagus. When it gets to be excessive, that's when we start to see damage, and that's when we get a lot of symptoms. And there are atypical symptoms as well that we should talk about.
Yeah, you mentioned that, the things that we
Sure.
think about, but then what are some other things that you'll actually see that could
Right.
mean a bigger problem?
With heartburn being classic, and then there's the atypical symptoms like chest pain. The most common cause of chest pain outside of heart pain. Now we don't want to disguise, you know,
Right.
cardiac. If it's cardiac, they should get a thorough workup. But if once cardiac's been ruled out for chest pain, the next most common cause of that pain is the esophagus and from acid reflux.
So what are some things that you would do then if that person was at that elevated risk?
Yeah, it would still be along the same lines, lifestyle changes, eating earlier, typically before 6, and then using acid reducers for a period of time to let the esophagus heal and getting them healed. And then once they're healed, they often can go get by with intermittent medicine and not have to take it all the time. You know, other typical symptoms or atypical symptoms are not being able to swallow your food, getting food stuck, okay. Which a lot of the country experiences at one point or another, especially the folks that have reflux. So chest pain, sore throat, dental problems, sore tongue, tonsil problems, sinus issues, all of those things can be a manifestation of excessive acid reflux.
Is this something that your office sees a lot of cases of, that people come in with these
Yes.
types of symptoms,
Yeah.
wondering, and then you can, of course, solve the problem?
Right. Yeah, most of the primary care world, your family doctors and your practitioners out there are aware of atypical symptoms, and so when people present with these kind of things, they will say, hey, maybe you haven't thought about this, but this may be your version of heartburn. And then they get them an appointment to see a gastroenterologist.
And I would imagine once you develop that treatment plan and they start seeing the results, it's a whole different life.
Right.
They get their life
It
back.
can change their life. They can get rid of chest pain. It can make going to the restaurant and having your favorite chicken dish or steak or calzone a better experience than choking at the table. It can make the chest pain go away. It can make your mouth not sore, It can improve cough at night and hoarseness and that sort of thing.
So your advice to someone, a viewer out there who may be experiencing some of these symptoms?
If you've got a family physician or a family provider, talk to them. Explore those symptoms and see if they think it may be reflux and they may need a referral. If they're not sure and they don't have that available, they're certainly welcome to call our office at any time.
All right, certainly an important topic, one I think a lot of people can relate to.
Well, one of the things that people don't realize, one of the consequences of acid reflux, if you put up with it long enough, is cancer. And you can actually get cancer of the esophagus caused by acid reflux.
So if you can simply treat it earlier on,
right,
you can avoid
and
that
prevent
problem.
that. Absolutely.
All right, Dr. Fenyves, thanks so much for your time today.
Oh, you're welcome.
We'll give everybody a website for more information. You can always visit their office, call their office, or go to digestivewellness.net. The preceding portion of Daytime Tri-Cities was sponsored by